Now for some changes from the Trump administration. Some key federal government health websites have vanished over the past couple of weeks. We're talking about pages for agencies like the CDC, the NIH, and the Health Resources and Services Administration. That one helps improve access to health care for the underserved. The pages include data on LGBTQ plus health, HIV prevention, and gender identity. A court ordered many pages to be put back online, but some feature warnings saying the information is not supported by the current administration. Dr. Kamal Mengranjani joined as an assistant director for cancer innovation and public health under the Biden administration, and she joins us now. Doctor, thank you very much for being here.
Great, thank you for having me.
So what concerns you most about the removal of this information from government websites?
Yeah, so it was around 8,000 federal websites that went down, including some key public health websites that included information on HIV, risky youth behaviors, and also on disaster recovery planning. So these things are really critical. And when we don't have trusted sources of public information, that's when misinformation can take hold. And this can both affect public opinion and individual medical decisions.
So Kamal, and full disclosure, she is a former friend of, not former friend, she's a friend of my husband's, former colleague of my husband's. So I know Kamal and had no idea she was going to be on recently. So this is great. Great to see you.
Great to see you.
So does it mean that just the information is missing from the public domain, or are underlying research studies that are linked to this information, are those going away as well?
Yeah, a lot of these websites are now available once again. But it's really that when those websites go down and people lose access, that can affect research programs, and it can have, beyond misinformation, it can have effects like limiting access to medical research, and it can also affect public health responses to emerging threats like bird flu.
How so? How would it affect something like the response?
The data on these public websites is used to track what's happening at a population level, and this is the best resource that we have for that information. When these websites go down, it's just not available anymore.
We live in a world where certain words just put a prism on the conversation or a lens on the conversation. You worked for the Biden administration, which means a lot of the people who are listening to this are going to say, well, she's just against the Trump administration, which is taking these websites off. What do you say to that general partisanship view out there?
Yeah, I think it's important to understand that health is a bipartisan issue. These are things that are going to affect everybody in the country. If we're fortunate that bird flu is under control right now. If it were to pop up and become another pandemic, this is something that would affect people no matter what party they belong to. And that's the general ethos of public health. The goal is to try to maintain the health of the country, no matter who people are, where they live, or what choices they make.
So Elon Musk's Doge has also targeted funding at places like the NIH in terms of offering grants to research institutions, universities. What concerns you about that?
Yeah, in addition to providing information on these public websites, institutions like the National Institutes of Health are also providing grants to researchers. So the NIH is actually the #1 funder of biomedical research in the world. And there is a proposed cut on a certain type of NIH funding that would cap the amount of money that institutions that support research can get for paying rent or keeping the lights on, things like that. These cuts would amount to $100 million or more in losses for universities and research institutions. And what I'm hearing is that some of them are worried that they'll have to cut their research programs in half or shut their doors completely. And we're really worried that this could mean that we'll lose a generation of treatments for diseases like heart disease, diabetes, and cancer.
All right.
It's dark.
It's hard to square all of this because they're looking for efficiencies, but then we also hear that these efficiencies could, cost science and impact our health. So we'll see. All right, Dr. Kamal Mengranjani, thank you so much for being here.
Thank you.